at the end of the day, people respect your transparency, because results everybody knows are not in your hands, right?
True, true. Very true, very true.
So I think we are live, and you can start, madam.
Good morning, everyone. So we'll be starting a series of masterclasses on male infertility. And I know Dr. Jay is, as he mentioned just now, that he has deep interest in this and has immense experience. So like a conventional semen analysis report where we concentrate only on, say, motility, morphology, and the number of sperms. Now, I think we go one step beyond it to improve or to counsel our patients about the success rate of their ERT by doing these extra or higher end tests. So one of those tests is the sperm function test, and the most important one and most practically used one now is the DNA fragmentation index, sperm DNA fragmentation index. So I request Dr. Jay to throw more light on this, which will be useful for many of our members to, I think, incorporate this into their clinical practice, both for counseling the patients and also to choose what ART procedure needs to be done based on the usefulness of the sperm DNA fragmentation index. Over to you, sir.
Yeah, so I will start with the screen sharing. Shilpa madam, just tell me if you can visualize the screen and my thing is audible.
Yeah, all good.
Okay, so I think before we try and understand anything and everything as far as DNA fragmentation is concerned, okay, it is important, okay, that we understand something about how a sperm is formed. All right, and that is going to give us a beautiful insight. Okay, so if I draw the reproductive system of a male partner, you are going to have two testes in most of the situations. Then there will be an epididymis. Okay, this is a picturesque representation, and then there will be vas deferens, which is going to lead into a seminal vesicles and then into the ejaculatory duct. All right, and you must try and understand that if I magnify the testis, okay, testis obviously is divided into separate individual lobes, and it has end arterioles and all these things. But when I go at the basement membrane, you should remember that there is something which is called as the blood testis barrier. Okay, this is the reason why the testis is protected from a lot of things apart from viral infections, because the viruses can cross this barrier very easily. So if I draw, this is the basement membrane like this between the two tubules. Okay, you will have something like Leydig cells which are present in the between here. Okay, and you will have the blood vessels coming inside. So let me just draw the blood vessels in red so that people understand it. Okay, so there is this barrier, okay, which is going to be present between the two seminiferous tubules. All right, inside the seminiferous tubules you are going to have Sertoli cells. Now I'm just drawing this Sertoli cells in a 2D, but remember they are positioned in 3D. At the basement membrane of this you have your spermatogonia. Okay, now this spermatogonia are some of them are stem cells. Okay, some of them are primary spermatogonia. Okay, now this, as you see, is a round cell. Okay, this round cell then migrates up the barrier and then becomes slightly oval. Then there is some condensation which occurs and it forms a small tail. And then there is final maturation, and it gives rise to the formation of a sperm. Now all this sperm basically is formed from a single cell. So this guy is actually derived from this guy. All right, this is something which you have to keep in mind. Okay, but whenever it undergoes this process, okay, it is completely dependent on the Sertoli cells. It is completely dependent on this guy, on the Sertoli cell, because Sertoli cell is the only person who has the access to the blood vessel. The sperm doesn't have the access to it. Okay, that is important for you to understand. So if I magnify all these things now, see how the development occurs. You have a cell like this. It has a nucleus obviously in the center, as you know. It may or may not be actually in the center, and then there are so many mitochondria and Golgi body and lysosomes and 100 other things which are present, right? Now this, as a part of its development and migration, then undergoes a series of changes over the next 50 to 80 days, where the nucleus starts going on the top, the Golgi apparatus starts to go above it, the mitochondria start to get arranged in the center, okay, all these things, and then finally through this entire step, okay, it gives rise to the formation of a sperm which has a tightly compacted, this is an important word, the word tightly compacted DNA at its head with a tail which is formed here. All right, so this is very tightly compacted, everything, okay. The 80 to 90% or 95% of this sperm head is formed of the nucleus, and surrounding it is the acrosomal cap, right? This is what we know. So what typically happens is, see, at this stage, there is good amount of cytoplasm, and at this stage there is a loss of cytoplasm. Now this is the most important thing you need to remember. So whenever you have a good amount of cytoplasm, your ability to correct is very high, okay. If there is a problem in the DNA, you can go and correct it. When there is loss of cytoplasm, your ability to correct is lost, okay. So whenever your ability to correct yourself goes down, it is this guy, it is this sperm which is highly susceptible to reactive oxygen species. It is susceptible to all free radicals. It is susceptible to everything because this guy has no corrective mechanism. And because this guy has no corrective mechanism, God has designed abundance. That why itna produce so many of sperms that some of them are going to be healthy, because quite a lot of them cannot cope up to the free oxygen reactive species and all these things. So produce these guys in abundance. Okay. In the process of any cell, any human cell, okay, if I look at the DNA which is present inside the nucleus, if I just draw that DNA for all of you, all right. So we know the structure of the DNA. It is like that double helical. See this? If I just draw, we remember biochemistry mein something like this we had read. This is how our DNA looks like. Correct? So at every given point in time, what happens is this: there is some problem which happens in the DNA at one location, another location, third location, and then there is a corrective mechanism. So this corrective mechanism is very simple. This corrective mechanism has a lot of proteins, histones, proteases. Okay, many pathways are existence. Let's not go into the molecular details of all these things. But what typically happens is this DNA undergoes corrections. Okay, now when the DNA correction becomes defective, that means when there is not enough material available to correct, what will happen is this strand will develop a break. That means this part of the DNA could not be corrected. Sometime it could be a single strand defect. That means single strand is defective. Sometimes it could be double. That means double strand defect. Okay, both of this are bad. Okay, both of these are bad for sperm. In fact, let me tell you, the double strand defects are worst. Because if the double strand defect is not corrected, that means there is an abnormal gene which is going to present. And this abnormal gene is going to cause into an abnormal sperm, which is going to result in an abnormal fertilization. Okay. And it is going to reduce into reduced success rates. Okay. All you need to remember is this. Forget everything else. So when you look at sperm DNA fragmentation, the sperm DNA fragmentation is basically, okay, a judgment. Okay. Your sperm DNA fragmentation is a judgment, okay, of how many sperms which you study in a sample, okay, are fragmented. That means have a defective DNA. How many of them are non-fragmented? That means the percentage, that means the correction mechanism is good. Okay, so that means they are defective. Non-fragmented is good. Okay, and then you have degraded. Degraded is basically the mechanism where the sperms are actually apoptotic. Okay, so the three things, these are the three things which you need to remember. So now comes to the clinical aspect. Okay, you understood all these things. Okay, by DNA fragmentation, this is what matters. All right. Now, when you come to the clinical aspect of this, then you will be like, but then why do we need to study all these sperm DNA fragmentation? Because your basic semen analysis, which you have reported, your basic semen analysis could be normal. Okay, could be a normal report, but there is no fertility. But the couple is infertile despite having normal female parameters. Okay, so then you will be wondering that I will further investigate the female more. So what used to do at one point in time, all of us, nahi? Traditionally we were doing diagnostic histolaparoscopy. Okay, correct. Something is defective in the female only because we don't have further reporting for the male. But now for the males, you have this sperm DNA. Okay, so basically your reason to test for sperm DNA is a lot of things. You need to test, especially in unexplained infertility. That is one of the most important parameters, and you will see a lot of defects. Okay, you need to test this in cases of failed IUIs and IVF. Failed IUIs and failed IVF. Do you need to routinely do it prior to IVF? Now, so my answer is yes. Okay, I do it prior to IVF cycles mandatorily. Okay, there could be people who don't want to do it, but my answer is yes, you should do it. All right. RPL, recurrent pregnancy loss. One of the things could be abnormal DNA, especially this double strand defects. But can you identify a double strand defect? The answer is no. But remember, recurrent pregnancy loss mein sperm DNA fragmentation has to be tested. All right. Poor morphology sperms. Okay, remember, poor morphology sperms predominantly indicate a testicular cause. Okay, it predominantly indicate a testicular defect, and if there is an inherent testicular defect, they will have an abnormal DNA fragmentation index. So keep this in mind. This is something which you have to test for your male partners, especially when there is a poor morphology which is proven. Okay, that is when you need to test this. These are the 3 or 4 commonest indications. Okay, which you need to keep in mind as to when you should do a sperm DNA fragmentation test. All right. I will be, of course, showing you the reports and everything. But before I show you the reports, everybody is interested in only one thing, that, okay, I have a patient where sperm DNA fragmentation report is abnormal and I want to give antioxidants. Okay, because I have been told by my pharma rep that antioxidants will work the best. So most of them don't know the spelling of antioxidants because they are giving wrong information regarding that. It's a well marketed product. Okay, so remember one thing, if you have a testicular cause, okay, and if you have a non-testicular cause, I'll just divide a non-testicular cause. Okay, non-testicular cause is going to be predominantly including varicocele, lifestyle. In our country, very common is obesity, diabetes mellitus type 1 and type 2. All right, infections and toxicity. Okay, testicular cause is basically when all these parameters are absent. When none of this is present, then you must be probably suspecting a testicular cause. Remember, in any form of testicular cause, you need 2 reports, both having consistently DNA fragmentation index for the patient of more than 30%. That virtually, in the absence of 1, 2, 3, 4, 5, 6, 7, in the absence of all these things, that means it is a testicular cause, practically speaking. And these type of patients usually will end up doing either IUI or IVF. Okay, when you have a varicocele, which is a large varicocele, palpable varicocele, so varicocele which is palpable, okay, there are multiple treatment options. Lifestyle modifications, we all know. Obesity is a very common problem in our country. Diabetes requires correction. Viral infections, okay, in COVID we saw a lot of patients who had temporary azoospermia due to COVID. Like that, due to a viral infection, you are going to have situations where there is going to be a temporary rise in DNA fragmentation. So keep that in mind. And when you say toxicity, it is obviously chemicals and chemotherapy, radiation therapy. This is usually untreatable. Okay, this is very difficult to treat. So all these factors may benefit from antioxidant therapy, and your antioxidant therapy is to be usually provided to the patient for 3 to 4 months. Okay, now remember, which is the best antioxidant? I don't want to get into it. I will take a lecture. I prefer to give Ayurvedic antioxidants, and I have gone on record stating that the original Chavanprash which was made in our houses is one of the best thing, because that original Chavanprash is something which has more than 32 micronutrients. Okay, with that, okay, with this much information being conveyed to all of you, I will try and show you some reports now of DNA fragmentation. Okay, remember, DNA fragmentation, 2 or 3 things are important: sperm collection, slide preparation, and then the reporting. Okay, these three things are important. So you need to have an excellent technique for collecting sperm in a good condition. You need to have an excellent technician to prepare the slides for your patient in a very good manner. Okay, and then you need to be doing an excellent reporting of the same. Okay, these three things are critically important. DNA fragmentation can also be studied on frozen sperms, so there is no problem in that. Basically, you don't need motile sperms to study DNA fragmentation. Just keep that in mind. You can study it on immotile sperms, you can study it on testicular sperms, you can study it on frozen sperms, you can study it as long as there are sperms. All right. So the slide preparation is something which is important, because the slide preparation takes approximately 2 hours to do after the sample is collected. This slide preparation has to undergo a series of reagents which are done. You need something to, in order to immobilize the sperm. Then after the sperms are immobilized, you need something to stain the sperm, and after the sperm is stained, you need something to wash off everything else and just stain the head of the sperm, because what you are trying to study is the head of the sperm. So these type of tests which are done basically are dispersion assays. Okay, just remember in one word, what is a dispersion assay? A dispersion assay is something where, if the sperm DNA is good, okay, just remember, if the sperm DNA is good, it will have lot more dispersion. If the sperm DNA is bad, there will be no dispersion. Okay, just keep this much in mind. How do you interpret this? So once upon a time, when we did not have this software which has AI inside it, I'm going to show you the software. When we did not have the software which has AI inside it, we look at the thickness of the head which is stained. Okay, and if the splaying is more than half of that, that means if the head thickness is this much, then the splaying is half of that, that means it is a good non-fragmented sperm. If that splaying is half of that, less than half of that, that means it is a fragmented sperm. And if there is no such thing, okay, then that means it is a degenerated sperm. So with this much, just very small 1-minute video I will show you, so that then we can proceed towards the questions. Okay, so I will switch my camera. I think you guys can see the computer screen now. Okay, so when I try to show you the computer screen, can you see this first sperm? It is written, it is a non-fragmented sperm. Okay, this one. 1 minute. I will just use my cursor here. Just a minute. Yeah. Can you see this sperm? Can you see this sperm, all of you? This, it is a non-fragmented sperm. Can you see NF, non-fragmented sperm? The head is this much. The splaying is almost equivalent to the size of the head. Can you see? So it is a non-fragmented sperm. Very simple. Can you see that other sperm? See, this is the head of the sperm. Okay. The splaying is non-fragmented. So this is a non-fragmented sperm. I will show you a very beautiful degenerated sperm also. See, degenerated sperm, DG, degenerated sperm, no splaying. Just the sperm head is there. There is no splaying only which is visible. Can you see?
Yeah.
So that means it is degenerated. And I will show you what is a fragmented sperm also. Yeah, see this one. See, can you see? There is splaying, but the splaying is less than the half the thickness of the head. Can you see? So this, once upon a time we were reporting manually. All right. Of course, just if you want to go into more details, no, there is this detailed reporting. Can you see this? Which mentions the size of the halo. See, small halo, degraded, so no halo, medium halo, non-fragmented. Can you see this? Medium halo, medium halo. See, small halo. All this is reported itself by the computer. Okay, based on the software program. But it is important to understand that when you do this type of reporting, people like us, we have this habit of still verifying it. We look at the slide and we still verify it, and the minimum number of sperms which our staff has to study has to be at least 300 sperms. So even if you look at this report, no, see, I'll just show you this report which I was currently demonstrating to you. See, the minimum number of sperms evaluated is 354. Can you see that? And the number of sperms which were non-fragmented were 258. Number of sperms which were fragmented were 62 and degraded sperms were 34. So your DNA fragmentation index is 27.12, right? So normally people are going to come and tell us, okay, DNA fragmentation less than 15 is considered to be the best. DNA fragmentation which is between 15 to 25 is considered to be equivocal. Okay, and when DNA fragmentation is more than 25, it is considered to be a abnormal DNA fragmentation. All this is right. Okay, all this is right. But clinically, a lot of this is going to depend on how beautifully the slide is made. Because if the slide is not made correctly, you can have an abnormally high DNA fragmentation which is reported. If the slide is not made correctly, you can have an abnormally high number of DNA degraded sperms. So remember, when you do a good DNA fragmentation, see, the reason why I'm stating this is I am a verification laboratory for the laboratories where you are sending sperms. Understanding, most of the people will not send sperms to a gynecologist to report DNA fragmentation. It's simply unacceptable, okay, as a part of professional practice, correct? So they will send to a particular laboratory. Now, when this particular laboratory has an issue in their reporting, that is when they come back to us that, yeah, can you please report this one time more for us, okay? So that is why I'm trying to tell you, your slide preparation, everything depends on your slide preparation. So please keep that point in your head. Slide preparation is important. Now, one place where slide preparation doesn't matter is when you do this DNA fragmentation reporting on flow cytometry. That means you pass the sperms through a machine which has flow cytometry. So that machine has several rays sort of a thing which are coming onto that particular sperm, and then it will picks up degraded sperms and abnormal sperms and non-fragmented sperms. But the biggest problem in that is these sperms are motile, and when the sperms are motile, it can abnormally pick up the same sperm 2-3 times. Okay, so that is a big problem in that. And simultaneously, the sperms, leukocytes and RBCs, all these guys are almost the same size. So quite a lot of time, abnormal leukocytes and abnormal RBCs are represented as normal sperms. Okay, that is because they have the same, because there is no splaying which is done in that. It is just a sperm which is flowing through a cytometry assay. Okay, there is a simple machine which is available to do that, and probably that is not one of the best methods of looking into it, because it has a lot of mistakes as far as the sperm is concerned. Okay, but yeah, that probably concludes my basic understanding and evaluation of a sperm DNA. We can go really deep into it, but I want to tell everyone that, see, the normal report which we issue is going to be something like this. This is the standard reporting format which many people follow. Okay, but then there are going to be images of the sperms. Can you see these images? All the patients would get one field. How many fields we have reported? I'll just show you. For this patient, we have reported 10 fields like this. So we have 10 pages of printed report showing the sperm. So tomorrow morning, if somebody tells, he doesn't know anything, yeah, he doesn't know anything at all, I don't trust his reports. Very good. Don't trust the sperm reports. Okay, because when you give an image, it becomes very difficult for the opposite person to say that the reporting has not been done correctly. Okay, so this really goes a long way in reducing professional jousting, and I have been experiencing this over the last 5 to 6 years. When you give printed reports, patients are happy, colleagues are happy that, okay, the report is good, no problem. I don't think there is a problem. Okay, because remember one thing, this is a very sensitive issue. Any sperm parameter going wrong, you will have the male partner doing at least 2 to 3 consultations. There is no way in which he will go and rely only on one person. The commonest thing which anybody else is going to tell you is that, why don't we repeat the test from some other laboratory? Okay, and that's where you will score over everybody else. If you go and repeat the test from some other laboratory, and that other laboratory does not give you this report, then the person will come back to you that, no, they did not give me some clarity, I want to go ahead with your treatment. Understanding, because remember, in everybody's hands, the treatment is standardized. Nobody is going to come from heaven and apply some lip balm over the testis and reduce DNA fragmentation for that guy. All that things don't really work. Understanding, it is simple. It is very simple, right? One of the techniques which people follow apart from antioxidants, and it is documented, okay, is to do frequent masturbations. But one big mistake which people don't understand is, you should allow the male partner to have frequent masturbations for the first 15 to 20 times. Okay, first 15 to 20 times, because that is the sperm which is going to be stored in the seminal vesicles, which is going to get released. So for example, when you do the vas deferens ligation, as a part of sterilization. Even after that, if you study the textbook of sterilization, it is reported that for the next 30-40 ejaculations, the male partner should still wear barrier methods of contraception. That means condom should be used, because the sperms which are released from there are actually stored in the seminal vesicles. So when you ask somebody to undergo frequent masturbations, first 15 to 20 frequent masturbations, first 15 to 20 masturbations will have the same abnormal DNA. After that, if you ask the guy to have a masturbation every 2 or 3 days, okay, then in the next 1 to 2 months, there is a probability that DNA fragmentation will go down. The reason for that being the time which the sperm spends inside the body is reduced. So when the sperm spends less time in the body, the post-testicular factors, smoking, lifestyle, obesity, whatever, okay, they have less chances of acting on that sperm. Understanding? That is the logic. So if you see a DNA fragmentation today, you ask him to have 4 masturbations and repeat it, the value is going to be the same. So you are ideally supposed to repeat it after 35 masturbations. Just keep that in mind, because 90% of the people don't know this. They ask the patient, go have frequent masturbations. He will masturbate 4-5 times, come back to you, report will be higher. He'll be like, "Arey, now I masturbated and now my DNA fragmentation is higher." The reason being, it takes this much amount of time for the sperm to get cleared off from the system. All right. So just keep that in mind as far as this test is concerned.
Okay, so let us talk about the clinical implications. At what DNA fragmentation index do you suggest that stop doing IUIs, go for IVF or ICSI?
40.
And when do you suggest them not to give the masturbated sample, but use a direct testicular sample for ICSI?
So any DNA fragmentation more than 40 is a testicular cause. As I mentioned, more than 30 on 2 occasions means it is a testicular cause. These guys will do the best with testicular sperms. The reason why these guys do best with testicular sperms is that despite being a testicular cause, okay, though that sperm which is produced from the testis will have inherent DNA fragmentation problems. Understanding? But the exposure to post-testicular factors goes down drastically, as a result of which the testicular sperms are the best in high DNA fragmentation males. And you must remember, when we culture these embryos on time lapse, you will see that out of 15 oocytes, 10 will fertilize. So that fertilization rates are down with this because of the abnormal DNA. Okay. You will have embryos with slightly higher fragmentation, and you will have embryos which have poor blastulation rates. Okay. This is commonly seen. I can show you countless time lapse videos of the same. Okay. And when you do a testicular sample for the same guy, okay, your outcomes will be slightly better. Okay, your fertilization will be better. Blastocyst rates, nobody knows, but your fertilization will be better. That much I can assure you. Okay.
So below what sperm count you cannot do a DFI? As in, some reports will say that
See, as long as you get 300 to 400 sperms, madam, you can do it. Okay. So just keep that in mind. There is nothing that below this count you can't do. You should have 300 to 400 sperms.
Okay. So varicocele and DFI, I mean, what grade varicocele do you advise surgery?
Palpable varicocele, which is causing abnormal sperm parameters, especially low sperm counts with limitedly good motility. Okay. These are people where the DNA fragmentation, if it is more than 25, then varicocele surgery may benefit. Okay. May benefit. So there is nothing proven, but it may benefit.
Okay. And DNA fragmentation index, how much do you charge in your clinic?
Okay.
Somebody has asked. I didn't want to ask this. Okay. I know that we can't charge like you do, but somebody has asked.
So I take anywhere between 12 and 20,000.
We do cesarean, for that rate. Okay. Okay. Fine. So on this, oh God, you charge so much. Okay. So
the highest I have charged for a DNA fragmentation is 1 lakh rupees in my career. Okay.
That is our monthly salary,
Yeah, that's why you have all different colored Mercedes. Correct.
Okay. So now, see, there are available commercial kits for this DFI.
Yeah. The important thing about those kits is those kits need to be refrigerated, because these kits contain binding media. Okay. The problem with those little, kits are the same almost everywhere. Okay, it is the software which makes the difference. It is not the kits. You have a good kit, you have a great technician who will make the slide beautifully well. You will see the DNA fragmentation, but then you will have to do a manual reporting. Okay. Now, when you don't have a manual, I mean, when you go wrong in manual reporting, you have to rely on AI. Correct. Which is why it is important to have a good software which is driven by computer assisted, semen analysis technologies, which will help you. Definitely, it helps. See, there is no question in that.
But see, I mean, everybody don't have this CASA what you have. This is a very different one you are using from so many years. I mean, I was surprised to see that one what you are using. But see, if they are doing it with the commercial kits and they are doing manual reporting. Okay.
Yeah.
So with this, I mean, what is the most important step in that? Is it the slide preparation or is it reading the slide at the end?
When you are doing it manually, you actually need to spend 1 to 2 hours reporting that slide, because when you report for 300 sperms, madam, it will take time. And the possibility of human error is very high. Please keep that in mind. Something which I feel which is degraded, you may feel it is non-fragmented. Correct? Something which I feel is non-fragmented, you will feel it is fragmented. So that error is very high. The advantage with the CASA or any software is, first it goes down and calculates this. See, you have to understand this. See, first it goes down and it calculates this white region. Can you see that? There is a white region and a red region. So first it goes and calculates the white region, madam. After that, it goes and calculates the amount of splaying in that red region. Okay. For that particular sperm. Once it goes and does that, then it uses its own algorithm where there is a differential that, okay, 20% could be wrong, 10% could be right. And then it gives you a report of what is fragmented, what is non-fragmented. So you must keep that in mind. Definitely it helps. See, there is no question.
Yeah. So somebody is asking, they want to send the samples to your center. So would you be willing to accept the samples to do the DFI?
We have no problem. You freeze the samples and send it to us.
Okay, yeah.
Cryoship.
Thank you. I think that was a wonderful session. The rest of the questions we'll take on the group. I know this is a very, I think it needs more
extensive topic. Yeah.
Needs more discussion, especially on clinical applications. But it was a great one. Thank you so much. We'll discuss this again whenever time permits.